So when groups, health groups, and health systems and medical groups begin to address equity, the issue of social determinants comes right to the fore. What's the role of health partners in addressing social determinants, and what sort of things are you doing in that area?
Yeah, I think one of the things that, the health system itself is relatively expensive, and so how do we make sure that we're not duplicating efforts and just adding to our expense? So I would say one of the things that we've tried to do is how do we identify our community partners and also public-private partnerships as well. And so our role is to help identify where there may be some social determinants of health that are preventing people from reaching their full potential, and then making those linkages into those community resources. I would say a few things. We're fairly geographically diverse, even though we're in the Twin Cities. We're spread out pretty far, and so all of the community resources are pretty local. And we have kind of like a directory, if you will, so that our care coordinators know what resources are available in our different communities. And we're starting to screen for social determinants of health at different touch points along the way, either through our clinicians or mainly our care coordinators and identifying needs. And then I think one of the things that we did that has been well received by our clinicians and care teams is we know anytime you have to go out of the electronic health record into another system, into another web interface, the chance of it happening goes down by like 50 to 90%. I'm making this up, but people aren't going to want to go out of their usual workflow. So we worked with a local agency that addresses food insecurity, and with the patient's permission, we can do an electronic referral to that organization, and they will contact the patients and provide them needed food, and also make connections to other agencies to address the other social determinants of health. So that's been really well received, and it's been a nice partnership with the community resource.